Hi, I'm Dr. Salil Kandwala, and I'm the medical director at Advanced Urogynecology of Michigan. Today, we'll be talking about overactivity of the bladder or urinary urgency incontinence. It's a huge problem in women. We'll discuss it under these different headings. We'll talk about the different terminologies that we use, how common is this problem, what is normal and why does this disease happen, and then how to do a proper history, examination, and evaluation, and finally, the treatment. So let's begin by discussing the different terminologies and how common it is. So first and foremost, this term frequency means the number of times a person goes to the bathroom in the daytime or the nighttime. Nighttime frequency is called nocturia. So the number of times she goes to the bathroom, but each urination must be followed by sleep or the intention to sleep. So it's not like you get up, you pee, and you start going back to your all activities and you wake up for the day. You've got to go back to sleep to account for that number. Urgency is a sudden, compelling desire to pass urine that is difficult to defer. That means you've got to do something. Start walking to the bathroom, do something. Otherwise, you can get urgency incontinence where urine just starts leaking because you have severe urgency and you cannot postpone urination. Typically, in the past, we would call frequency as more than 7 times in the day. But now, if it is any number that is bothersome to the patient, it could be 5, but she went only 3 times. And now if she's going 5 times and it is bothersome, then it is considered frequency in the daytime. Nighttime, if it's 2 or more, that's considered nocturia. But then again, if a patient never woke up and now she's getting up even once and it disrupts her sleep and bothers her because she cannot fall asleep right away, then it would be considered nocturia. So it's more about how the patient perceives as a degree of bother. Overactive bladder syndrome is characterized by urgency with or without leakage, usually with increased daytime frequency and nighttime frequency without any bladder infection or any obvious pathology. Nighttime nocturnal polyuria or increased amount of urine production at night. And that is if more than a third, 1/3 of the total urine volume produced in a 24-hour period happens to be at night in a woman aged more than 65, or if more than 1/5 of the total volume happens at night, then that's considered as nocturnal polyuria. So more than 1/5 is in a younger woman, more than a third in an older lady. It's very common. So how common this is? It's very common. 15 to 40% of women have overactive bladder, men and women. And the average cost is about almost $700 to $900 per person. And that does not include the indirect costs, of losing time from work, wearing pads, buying pads. Medicare claims from 2003 to 2004 show that it was about, $2 to $4 billion. Now, if you look at that without changing the increase in number of women with this problem, let's say if you get the same number of women having it, but change the inflation and into a 2018 US dollars, it would be almost 2.5 to 5 billion per year. So it's a huge cost expense. 70% of patients bothered by overactive bladder do not return to their specialist after one clinic visit, and they continue to suffer. I mean, you got to wonder, right? 7-0. Why are they not coming back to see me? What's wrong? So we'll talk about in the next slide. I'll go over this again and again, and we will try to break this down so that we can drop this number down too. So the next, we'll talk about what is overactive bladder, why does it happen, and what is the normal physiology. Thank you.